Hi there, my name's Brendan Gameter. I'm a small animal vet from New Zealand. I graduated in '94 from Massey University and gained membership to the Australian and New Zealand College of Veterinary Scientists and Small Animal Medicine in 2003. I'm going to demonstrate this prototype companion animal veterinary app for smartphone and tablet. I invite you to make comments and ask questions. I'd like to make this resource available in the most user-friendly way, so all feedback is welcome. So, on with the demonstration. This then is the home page. Now, clicking a home link from anywhere in the app will bring you back to this page. As you can see, there are two lists. On the left, we have the differential diagnosis list. From here, you could type in any symptom in the search field, which will bring a list of differentials for that symptom or sign. For example, if an animal presents with hematuria, typing this in will bring up a list of causes, along with a diagnostic plan to figure out what is causing that sign. Alternatively, you could click on the urology tab, which will bring up a list of all symptoms under that heading. Note too that there is a clinical pathology category, second from the top, to help you interpret blood results and how to differentiate the causes of a particular abnormality. This also has flowcharts to help differentiate the different causes of those abnormalities. On the right is the disease list. Here you will find information on different diseases, again categorized into different systems or fields. So for this demonstration, I will use a hypothetical situation in a consult room scenario. Suppose a young cat comes in with a history of drooling, of quite recent onset. The owner adds that there are vague signs of lethargy and inappetence, and thinks the cat is slightly wobbly on his feet. There's been no access to toxins that are known, and the cat is fully vaccinated and up to date with parasite control. So in this case, we could type in drooling in the search field or click on the gastroenterology tab. So this then is the list of symptoms under gastroenterology. And note again on the top right there is the home tab, which will bring you back to that previous slide. We could search any symptom or disease in the search field. So here we're interested in drooling. So if I either type in drooling or click on drooling, the third listed there, that will bring a list of causes of drooling. So there's our differential diagnosis list for drooling, in this case divided into tilism and pseudo-tilism. Note in blue letters are links to other parts of the app. So for example, if this cat had been vomiting, I could click on vomiting, which would list the differential diagnosis for vomiting as well as the flowchart or plan to get to the diagnosis. So there's our list, and now at the bottom right we'll click on plan, and here is our diagnostic plan for drooling. So in this case we have completed our history, and now second we will do our clinical examination. This will include obviously a good examination of the oral cavity. We'll feel the salivary glands, palpate the abdomen, and check the cranial nerves. And if the cat again had been vomiting, we would click on vomiting. If there was any facial nerve paralysis, we would click on that to give us a list of differentials for that particular sign. Or if there were obvious oral lesions, we would click on dysphagia, which would bring a separate list of differentials for that problem. In this case, the cat hasn't been vomiting, there's no facial nerve paralysis, and we can't see any obvious oral lesions. So we will go ahead and do a baseline blood test, complete blood count, biochemistry and urinalysis, which will take us to the question, are there other neurological signs? And yes, the owner did note that the cat had been a little bit wobbly on its feet. So then we therefore go ahead and do a bile acid stimulation test. While awaiting those results, in this particular example, the cat has deteriorated. It's becoming more lethargic and obviously more ataxic as well. The bile acid stimulation test comes back positive. In other words, there is significant liver dysfunction. So we'll go back to our list of differentials for drooling. And second from the top is hepatic encephalopathy. So it does seem that this cat has hepatic encephalopathy. So we'll click on that, which will bring us to that particular syndrome. As you can see, and all of the diseases will have this basic list: etiology, clinical signs, diagnosis, treatment, prognosis, and differential diagnosis. There are some exceptions. Some diseases will have a monitoring tab. Some diseases will have a clinical pearls tab, which adds in a little bit of information from my own personal experience. So in this case, obviously this cat has been deteriorating while we were waiting for blood results. We may have already started some form of treatment, but I want to know exactly what to do now. So I click on treatment, and in this acute phase, we would start with intravenous fluids, complete a cleansing enema, and if there was no response to that, we would go ahead and give the cat some mannitol. Now, having come through this acute phase, we would look at the chronic treatment of hepatic encephalopathy. From the bottom right of the screen, I've clicked next to bring us the chronic treatment. And I won't go through all of that, but basically dietary treatment, lactulose, zinc can be useful, and anthelmintics. And then again, if I click next at the bottom right, there's some further information, particularly, sorry, I'll go back to, there we go, particularly dietary treatment and also treating any underlying disease, which is obviously important. Now the owner wants to know what the prognosis is for this cat, so I'll click on prognosis and we can give the owner this information. The owner would like to know what possibly could be causing this problem and wants to understand a little bit more, so I then click on aetiology, which brings further information on that. Now, we could click on any of these, for example, diagnosis, and get some information about how to confirm the diagnosis if we weren't 100% certain. Again, bottom right, click next to get more on diagnosis. And I guess in this case, at the bottom, very importantly, is to try and identify the primary disease, whether that be a portosystemic shunt or other liver disease. So there we have the prototype for this app. Again, please comment, and I look forward to bringing this out in the next few months. Thanks for your time.